So, you know, if a woman is having problems of itching, according to some of the symptoms you're mentioning now, she might not really know what's causing it.
No,
because lots of things cause itch.
Yes, you see,
yeast cause itch.
Yes. Now, it's important to note that varicose veins is one of the spectrum of chronic venous diseases.
Okay.
Okay. It's actually the second stage. The first one is you have what you call spider veins.
Yes.
Our reticular and reticular
Those
veins.
little, you know, they look like
yes,
spider webs,
tiny,
actually.
Yes. And then varicose veins is the next set. So, in women that have problems, if a woman has problem with itching, it's not just to say, oh, she has vaginal infection, but there will be other things that would, like if a woman is having discharges, having fever, other things that could give you, yes, because you need to take a history, ask the patient some questions, some other symptoms, other things that.
Can they have it on the face, on the neck?
It can, but it's not. We call them other names. It's not really varicose veins. But when there's an obstruction, it can look like, it can look like a varicose vein, but it's not. We don't really call it varicose vein per se, but it's the same pathology, the same way it happens, like what we call superior vena cava syndrome. When the veins that drain the head and neck is blocked, you see the veins on the chest wall will become prominent and dilated. It's something like that, but it's not particularly varicose.
But it's not called varicose.
Yes, it's not.
Now, we've established from the pregnant women and all that, that being a woman is a risk factor.
Yes.
Are there others?
Yes. There are many risk factors associated. Number one, like you said, pregnancy. Because it blocks the flow of blood upwards. Number two, patients with intra-abdominal, anything in the abdomen that like a mass,
fibroid.
like fibroid, like a tumor, they can cause it. Patients with what we call DVT, deep venous thrombosis, that is, the blood has clotted within those deep vessels. I told you there are two sets of veins.
Which causes a backup of blood that is not.
And then patients too that are predisposed to long stays of standing, especially with surgeons. Cardiothoracic surgeons, neurosurgeons. We are also at risk.
Sometimes you do like 10 hours standing, right?
At a stretch, you're standing. If your job entails you to be sitting in one place, because when you are moving, the muscles of the leg act like a pump that pumps the blood against that gravity. So when you are sedentary, your lifestyle is sedentary, you don't do exercises, it affects it.
So it's not just sedentary sitting, it's also sedentary standing.
Sedentary sitting, sedentary standing, you're not doing exercise, you are overweight. And then if you have a family member, especially your parents, if they had varicose veins, it also predisposes, to varicose vein formation. So those are, and then people that are tall, height is also a very important risk factor because the blood will have to travel a long distance.
More gravity.
More gravity, yes, so before getting to the heart. So those are the some other risk factors associated with varicose vein formation.
When it comes to varicose veins in the legs, especially for women, we can't hide from the fact that it's a cosmetic problem.
Yes.
Nobody likes to see that stuff.
Even
for
the men now, it's cosmetic.
Really?
Yes.
Men don't really bother and they wear trousers,
I can tell you that, even for the men.
So what's your advice? Some sort of do-it-yourself thing that people can engage in to reduce these varicose veins or, prevent them from happening?
Like I said, it starts with reticular veins.
Maybe we'll see the pictures now.
Spider nervi, spider veins. Now, once you begin to see those, you know that it can progress.
What is this we're seeing?
That is a spider vein. It's a very tiny, they're less than 1 millimeter. That is a reticular vein. It's about 1 to 3 millimeters. Now this is a varicose vein. You can see they are dilated.
It progressed from those ones to this stage.
It can progress, yes. This is the fourth stage. The leg is swollen. You see the left leg is swollen.
The legs are actually swollen.
And here is another stage. You see there is discoloration of the legs.
Yes.
And here is the fifth stage. There's ulcer that has healed. And this is the sixth
ulcers,
stage.
Right?
These are the venous ulcers. These are the venous ulcers. So you can see this reticular phase. If you notice it from the beginning, If you are overweight, for instance, modify your lifestyle.
Okay.
Reduce your weight, your food intake, exercises. Exercises does two things. Number one, it helps you to reduce your weight. Number two, it helps with the pumping of the blood back to the heart from the legs, from the lower limbs. So if you do those, it's not likely going to progress.
Okay.
However, if it has progressed already to stage 2, which is the varicose veins itself, there are other conservative things you can do. Like if you are sitting, when you're at work, don't, instead of just sitting 8 hours, take breaks, walk around. Take breaks, walk around. Okay? And then when you're, you can also elevate your leg. It will also help you.
Like when you're at home?
When you're at home,
TV?
Yes, watching TV. Instead of just putting your leg on the floor, you can put it on a stool.
But that is when it has progressed to varicose veins, right?
But ideally, you need to see the doctor because that will help you. They will help you to treat it. Okay.
These varicose veins, are they painful?
Yes. It depends on the stage, though. Okay. It can be associated with pains, aching, dull, aching pains, heaviness, itching. Okay. All those are things that can predispose. And then for advanced stages of it, the leg can begin to change color to dark because of that pigmentation I told you. Okay. So it can become dark. Some of them actually, they notice it first when the discoloration have set in, or some even when the ulcer have set in. And especially, and sometimes, it's difficult at this stage to, especially in patients that are diabetic. You need to be able to now differentiate between a diabetic foot and a venous ulcer.
Yes.
Okay, so it's always good to note it from beginning and address it. So there are other, apart from raising your leg, elevating your legs, you can also do what we call compression therapy. Okay, where you use compression stockings.
Compression stockings, are
Yes.
those special stockings?
Yes, they are special stockings.
Women have these things they wear. They call them leggings, or they call them skinny jeans.
Skinny jeans
that they hug the legs. Can those work?
It may not work. You see, because the compression stockings are designed with a particular pressure. There are different sizes. So they have different pressures that they transmit to the veins, okay, to help in that drainage. So in the actual sense, it won't really help. But if it is tight enough, it can help. But you need to be wise about this because that's why I say you need to do the doctor, because sometimes these patients can also have associated arterial problem.
Okay, we'll talk about when we come back.
Okay.
We are going on a short break right now. Please stay with us. It'll be only less than a minute.